Good morning. It is November the 20th of 2020, and I want you to know this is Dr. Beck, and I'm here at LifePoint Medical, and we are up and running. However, we're on a different schedule till the end of the month or till December the 1st. Okay, so I want to explain to everybody what's going on again, so there's no misinformation or craziness going on. First of all, we are receiving calls. We're monitoring all of our communication lines, whether it's the website, the phone calls, the text line, the email. Okay, we're monitoring those. So if you reach out to us, we're going to respond to you, and we're going to try to help you and take care of you of your medical needs if you need us to. Okay. The only caveat is we're not having patients come in the office at this point. Okay, and the reason we're not having people come in the office is because I'm trying to be cautious when it comes to exposure to COVID-19. I do feel like that we've had some breaches uh, in our lines of protection here in the office, but we're just going to take a conservative approach to it, and we're going to stay here for you, and we're just going to listen and look at you and take care of you over video, so we can get you taken care of. And we're going to continue to be cautious amongst ourselves. We just can't risk people coming to the office at this point and possibly getting exposed. However, so we're going to do this till December the 1st, and that's an adequate amount of time for us to get through any weaknesses we have here, or hopefully to sequester anybody that might possibly have been exposed or could be exposed to the COVID. So we're just going to be cautious. We're not going to see anybody in person, and we're going to do that till December the 1st. Now, so we got the video visits going, but we also have the drive-through services going. Okay, and the drive-through services are where you drive up to the side of the building, and we have nurses who are appropriately protected who will go out there and deliver whatever services you need, even if it's a result of the video visit. In other words, if we decide on the video visits that you need blood work or you need something done, we're going to arrange so you can come through our drive-through and have the nurse come out there and help you with it. But we're also doing the COVID-19 rapid test. We're also doing the flu shots, and we're also doing B12 shots or whatever you want. And we've got a line around the parking lot out here. So if you want any of those services, you can come and get in line and then give us a call when you get close to the tent. And I've got people answering the phones. Yes, the phones do get bogged down, okay, so be patient with us, but we are paying attention to what we're doing out here, and we're going to try to get you seen and taken care of in a timely fashion with the drive-through services. I've watched a little bit of rattling going around about the COVID-19 rapid test versus the nasal test versus the antibodies in your blood. And I know it's confusing, and I've heard from a lot of local experts on immunology telling us what works and what doesn't work. Okay, but I'm going to tell everybody right now, we do not have enough information on any of these tests, any of them, to be able to give any kind of absolute direction on their usefulness or anything. Okay, but I will tell you that we have seen correlations. In other words, when I have a patient who comes in or who tells us that they think they've got COVID and they've got all the symptoms, the shortness of breath or the difficulty breathing, the cough, the upper respiratory, the loss of taste, stuff like that, if we do a rapid on them, a lot of times it's positive. Okay, so that automatically increases the value of the test. In other words, you've got symptoms and you have a positive test. That's pretty good evidence that you have the disease. Okay, and we can also add another test, the diatherix, where we do the nasal swabs, and that's another test, another way to do it, and that will increase the usefulness of the test. Okay, so it all has to be taken into context. You know, if you're a known exposure and you're having symptoms, yes, you can get the rapid test. If it's negative, that doesn't mean that you're out of the woods, but if it's positive, it certainly means that we've confirmed what you have. So all the rattling and everything you hear about how good or bad the tests are, there's no answer to it. And I'll tell you right now, if we had somebody from the CDC, an expert, who came to us and was going to tell you on this video, they don't know. It hasn't been long enough. It takes a long time to get these tests just right. Do I think we're making strides and improvements on them? I would say we are. I bet you, or I hope the laboratory companies that are processing like the nasal swabs, they should be tweaking what they're doing to increase the accuracy of the results. Okay, and I know that some of that's going on. Okay, but again, it takes process. You got to have hundreds of tests, and you have to do multiple tests, and you have to look at, were they symptomatic, which tests were positive, which tests were negative, what was the time frame between the time that they got the test and everything like that. And it's all speculative. So we're just going to do our best. If you think you have it or you've got symptoms and you're concerned about it, you're certainly welcome to come to get the COVID-19 rapid test here in the thing. And if you're an employer and you're worried and a patient, somebody has symptoms, that's a valid test. The only thing is, if it's negative, it doesn't necessarily mean that they don't have it. It just means if it's positive and they're symptomatic, they likely do have it. So if you're a patient of ours and you want the rapid test or you want the nasal swab, we can actually coordinate with you if you're a patient that's in our system, so we can get you a nasal swab. If you're not a patient of ours and you want the nasal swab and you don't mind us doing a telehealth visit to get an idea of what's going on with you, that's reasonable too. And if you'll call us, we will try to accommodate you and have you be seen via telehealth, and we'll put all the information in so that you can get back. We cannot take people off the street to do the nasal swabs because we have to provide all of your clinical information to the laboratory companies so they can process your claim. So that's the hold up there. Okay, so let's go to the video visits. Video visits, we're doing those. Okay, most insurances and Medicare pay for those now. That's been a big hold up until this COVID-19. Okay, is it the best way to see patients? Absolutely not. It's actually harder, I believe. But if you use our computer and use our system, it actually is more accurate than normal, because we have, if you go through the system's questioning, it'll actually help us hone in and be more accurate with our diagnosis. Okay, so we do have what they call, assistance with the diagnosis when you're doing it over the video. And I've actually paid for that service so that I knew that we were going to lose something when you see people through video. And this is not just me, this is the whole country trying to figure out what's legit and what's not legit when it comes to video visits. Okay, so, but we have things in place to actually increase the accuracy of or to compensate for what you lose for not seeing somebody in person. Now, I prefer to see people in person, and I've been doing it for a long time, so this is all new for us too. Okay, but I do believe for most things, we can help you over video. The only caveat to that is if we think you need to be seen, or we think it's an emergency where you need to go to the emergency room, we're going to advise you during that visit, hey, you really need to go see the emergency room or something like that. Okay, so we can, through the video visit, advise you on whether you need another level of care. Okay, so that's some of the valuable things we can do with the video visits. I've been studying the video visits for years, so I've been working on it for years. So use that service, okay? And everybody's paying for it right now, and that's a way for us so we don't have to leave you out in the cold, and we can get you taken care of and get your needs addressed, including refills and things like that. So use the video visit to your advantage during this time. The other thing is, if you're a Medicare patient, a lot of times older patients do not have the technology we need to do video visits. However, Medicare has provided a program called Chronic Care Management, which allows us to interact with you telephonically or through the telephone to do a lot of this stuff. Okay, now, in going through this, we notice a lot of people unenroll in this program because they don't want to pay a monthly fee or they don't want me to get paid monthly for taking care of them. Okay, however, this is a Medicare program that was set up, and it's extremely useful during times like this. Okay, so just this morning we were on the phone with somebody, and he refused to be Chronic Care Management, and I'm like, well, he won't participate in the program, but he wants the services that the program offered, and it just doesn't work. So if you are eligible for chronic care management, your Medicare, and particularly if you don't have the technology, which you may not be watching this video if you don't have the technology, ironically, please sign up for chronic care management so that we can interact with you with the phone, through the phone system, and provide you with what you need without you having to be seen, which is part of Medicare's thing. So as far as the local cases, the website for COVID-19 reported there was 523 cases. That's up 10 from yesterday with no attributable deaths. And I think it is notable to know that the deaths doesn't seem to be going up, and I thank God for that, and I pray for that every single day. So I do believe we all need to do our part and to stay diligent about social distancing, using the hand sanitizer, and using our mask, okay, while we go through this pandemic. And it looks like it's all over us around here in the community, and that's why we've took the measures that we had. Listen, 706-782-0016 is our number. Call us, leave a message. If the voice prompt, if a human doesn't answer it, we'll get to you. You can email us at office@drtspec.com. You can text us at 706-949-1129, and we'll coordinate with you through that. Or you can go to our website at www.drtspec.com, and we will get you set up so you can have an appointment to be seen if you feel like that's necessary. One last thing, we're probably only going to stay open long enough to get everything taken care of that we can through the weekend, and it looks like I'm going to be covering for this weekend. So we'll continue to give out the videos every morning, and we're going to try to accommodate people as fast and as rapidly as possible. And then for several reasons, we'll slow down or stop at some point during the day when we're not getting any more phone calls or we're not getting any more business. So be aware of that. So if you do have a need and you want to talk to us early, please give us a call so we can get to you rapidly and get you taken care of. This is Dr. Beck. We're going to make it through all of this, and everybody's going to be fine. And I'm going to keep fighting to provide you with services and do what we need to help you. And you just call us if you need us, okay? Have a great day. Sorry for the long video.